Hello everybody, good morning, welcome to Nursing YouTube channel. Today we will speak about most common cases in ER. At first we will classify this one as per age. For example, for child, most of child come to ER with fever, vomiting, diarrhea, tonsillitis, otitis media. For adult and above 45 years old, they come with cut wound or chest pain. Okay, what is the most common cases? Most common cases like stroke even, hemorrhage or ischemic stroke. After that, head trauma. Okay, if anything hits the head, so the patient will come with head trauma. The patient have meningitis or tonsillitis, chest pain like MI and stable angina. Stable angina is classified by ECG or cardiac enzyme done to the patient. Okay, and this is the most common cases. The most common cases come to ER. This is the chest pain. Okay, problem of the heart failure, ischemic heart failure, valvular disease, any problem related to the heart. Okay, after that, the chest. The patient with upper respiratory tract infection. He have infection, he have pneumonia, the patient COPD, the patient asthmatic, anything of this. The patient have pneumothorax or hemothorax. Okay, air in the lung or blood in the lung. So the patient will come to ER. If the patient have TB, tuberculosis, so this patient will come to ER and you will put in isolation room. Okay, after that, the abdomen, acute abdomen, any problem related to the abdomen, appendicitis, cholecystitis, pancreatitis, gastroenteritis, and for all of those, each one have a specific diagnosis. For example, for appendicitis, we can do ultrasound, CBC. For this patient, urine analysis. Cholecystitis, we can do for this patient ultrasound. Pancreatitis, we can do amylase lipase. Gastroenteritis, for this patient, he will come with diarrhea, vomiting, abdominal pain. Okay. Liver disease, anything related to liver disease like liver cirrhosis, hematemesis, melena, anything related to liver disease. Intestinal obstruction, this obstruction in the intestine. So this one will appear in X-ray or ultrasound, abdomen erect X-ray, so will appear in this one. After that, the patient diabetic. Under this one, we have the patient hyperglycemia, increase in RBS or hypoglycemia, decrease in blood sugar, or DKA, diabetic ketoacidosis, or diabetic foot infection. Diabetic foot infection with diabetes because the patient, if he have any wound in the leg, so this patient have poor healing for this one, so he will have diabetic foot infection. Some people reach to gangrene. Okay, after that, the patient hypertensive, increase in blood pressure to the patient. After that, cardiac and respiratory arrest. This is the most important patient to come to ER. Okay, after that, urinary tract infection. If the patient have urinary tract infection or have any problem related to urinary system like hematuria, BPH in male, or renal failure, urinary retention, renal colic. Okay, after that, we have the patient, he have fracture from trauma, RTA or falling from height, RTA or traffic accident, FFH is falling from height. So this patient, he will have fracture upper limb or lower limb. Okay, the patient shocked, any type of shock, so this patient will come to ER. After that, disturbed conscious level. The patient, if he is confused, he have disturbance in the conscious level, so he will come to ER. The patient burn, any type of burn or the degree of burn, so he will come to ER. After that, allergy from anything, food poisoning or allergy from food, allergy from medicine, allergy from the environment, so he will come to ER. After that, poisoning like food poisoning, like he take medication overdose, so he will come to ER. After that, we have patient have bleeding or hemorrhage, so this patient will come here. Even he have cut wound or bleeding from GIT, so he will come to ER. Okay, the patient who have syncope or fainting. Syncope, he lost conscious level for seconds or 1 minute, so he will come to ER. The patient who have pulmonary edema or pulmonary embolism, both of them will come to ER. Okay, after that, the patient who have cut wound, so he will come to our ER. Okay, after that, the patient who have COVID-19. This is the most common cases at this time. Okay, after that, surgical cases, all surgical cases. If he have IND, if he has abscess, if he have piles or hemorrhoids, so he will come to ER. The patient pregnant, the pregnant cases. So any complication in the pregnancy, so she will come to ER. If the patient have vomiting, if the patient have ectopic pregnancy, any complication, so this patient will come to ER. Now we finish our video today. If you found this video is good, please don't forget to subscribe and share. Thank you.